Hi everybody, my name is Gabe Muething. I'm one of the unified commanders for the incident management team here in Pcr County, dealing specifically with the COVID-19 incident. I wanted to talk to you for a few minutes today about testing. It seems to be certainly one of the big and hot topics here in our community, and I certainly want to be able to answer as many questions as I can. Most of the questions that we're getting are, why aren't we testing? Or why are the tests that are out there not a quality test? Why is it that we're hearing in the federal news and the federal arenas that testing is around, but in the state and local we're not? Tons of questions, and it's a very complex discussion. But let's see what we can do to answer some of your questions. The first thing is I want to talk about the testing that we've already done. Testing that we've already done is with our local population. We've done that on the vulnerable population, those over the age of 60, those with accompanying health conditions, and those that may be immunosuppressed. So that's our vulnerable population. We certainly want to test those individuals right off the bat, just to rule out any significant concerns that they may have. The next type of patient that we tend to test are those that will be admitted to a hospital. So those where a test may actually guide some of the treatment that we do for them. Again, both of those categories are fairly small numbers in our community. The test that we do is called a PCR test, and that test takes a swab. It's kind of like a big Q-tip, and we stick it up your nose as far back as we can get it, and it actually goes almost into the back of the throat. We're sticking it that far up your nose. And the idea with a PCR test is that we are actually trying to grab some of the virus itself. And as we grab that virus with that swab, then we can take that, put it into a lab, and we can test for the actual virus. Somewhat of an invasive test, and certainly it has its problems. First and foremost is 1 out of every 4 of those tests may show up as negative, but in actuality it's actually positive. So obviously that's a pretty high error rate, 1 in 4. So that's the first problem with it. The second problem with it is if we are to perform that test, it does take a huge amount of personal protective equipment. As you can imagine, we know that this virus is spread by droplet, or by the actual virus being spread by a sneeze or a cough, something like that. So as you can imagine, when we stick this swab up your nose, a lot of that virus can come out. It also can induce sneezing, it can induce coughing, it can induce gagging, which then sprays that virus out. The problem with that test, obviously, is as it sprays it out, somebody is actually standing in front of you to do the test. So we have to have a lot of personal protective equipment on. Everything from a face shield to a mask to a gown to a couple of pairs of gloves, and just a huge amount of that. Now, each test would require that after we do the test, the possibility of that spraying on us, we would actually have to take all that personal protective equipment off, put on an entirely new set before we do another test. As you can imagine, that's very, very intensive for use of PPE, or personal protective equipment. And that's in short supply, as you've probably seen in the news. So the other type of test that is up and coming, and we haven't really seen yet, is what's called an antibody test. And an antibody test essentially tests your blood and determines whether you have antibodies to fight against the virus itself. Now, the way to think about that are these are soldiers in your blood, and the soldiers go and they fight the virus initially, but then they also stick around and they hang around in your blood to continue to fight it should it ever show up again. So antibodies are a great way for us to determine whether or not you've had the virus itself, but also if you're fighting it currently. Great test. The only problem is there isn't really a good one out there on the market right now. Keep in mind, we've only known about this virus for 4 or 5 months. So a very, very short amount of time to develop this type of test. So there's a few companies out there that are starting to put some of these tests out on the market. We hope that we can grab one of those soon. But the problem with it is as the test comes out, they're done, all the research for them is done in such a small batch of research subjects that we really don't know exactly how accurate they are. At this point, we're hoping that they're very accurate meaning a 3 or 4% false positive or false negative rate. But at this point, we just don't know. Now, the good news about an antibody test is it can be done with pricking your finger and getting 1 drop of blood. And as you can imagine, what we talked about before with the use of personal protective equipment, that drop of blood is very, very easy to come by. We can actually have you drive up in your car, you can stick a hand out the window, and then we can prick your finger and you can go along your way. Very, very small amount of PPE or personal protective equipment that you need to perform that test. We would still wear the same face shield, the same mask, the same gown, the same gloves, but because of the fact that we aren't spraying virus everywhere, we would be able to reuse that PPE and just change gloves and change a face shield maybe. And that's really it. So really a very effective way to do this test. But again, there's not that many out there to begin with. And those that are out in the community right now or out in the, for distribution, we haven't been able to get just yet, nor has anybody for that matter. So it is a difficult thing to buy, but certainly the thing that we're looking for come soon, hopefully. I do want to address, I know a lot of people have had the question about why aren't we doing what Telluride or San Miguel County has done? And I think that's a valid question. I think what's important to understand is exactly what it is that San Miguel and Telluride are doing. And what it is, it's a biotechnical company that has developed a test. And what they want to do is validate that. So as we talked about the antibody test just a moment ago, this is one of those companies that is trying to do the research to figure out how to make the test. So what it entails is actually taking a huge swath of their county. I think they were hoping for 5,000 to 8,000 people in this study. And they would actually have blood drawn from a vein. And as you can imagine, that's a little bit more cumbersome and a little bit more difficult to do than just a fingertip prick. So that's what we're trying to do with this test. Now, Telluride has taken this on, and certainly, thank you to Telluride and San Miguel for taking on this type of a research project. But the biggest thing with it is that as you draw the blood, it takes a lot of PPE. Again, here we're back to our shortage of personal protective equipment. So to draw blood, now we're not only doing instead of a finger prick, which takes very little PPE, or trying to pull things out of the nose that can elicit a lot of virus and need a lot of PPE, drawing blood takes probably as much, if not more, than both of those combined. To draw blood, obviously we're working with needles. We have to be face-to-face with the person that we're testing for an extended period of time to be able to draw the blood. There's always the fear of the blood escaping, getting on the provider, getting on the healthcare provider. Theoretically, after every person that you stick with a needle, you would have to change your PPE. That person that's across from you, it's really hard to do that in a car, so that they would have to be with a mask and a gown themselves. So a lot of very intensive PPE work there. So we applaud San Miguel. We certainly think that it's great that they're helping out this company to do research so that they're able to have a test in the future. But for right now, that's not something that we're really willing to do based on the PPE. Now the question you're going to ask next is, why is PPE so important? Why is personal protective equipment so important? I think you really only need to look at the international news and see some of the foreign countries that have really received just a massive amount of patients from this. And you've seen pictures of their hospital where their healthcare workers are to the point where they don't have personal protective equipment left, and they're reusing old personal protective equipment. You've probably seen where some of the nurses and physicians have had masks on for so many hours that they actually have bruising on their faces because they can't continue to swap them out. So they end up using the same mask for the entire day. That's what we hope not to get into. And our goal, of course, is to make sure that that PPE is always available for our healthcare providers. We want them to be there and be safe when we need them the most. And that's our goal. That's our goal, is to make sure that we have enough PPE in our community to be able to supply them through even the largest surge of patients we may have here in our community. That PPE is really hard to come by. We're really working hard to make sure that we get it and supply our healthcare providers. Hopefully that answers quite a few of your questions. We'll certainly continue with these videos and help much as we can. We realize this is a really complex subject to talk about, but we certainly want to give you as many answers as we have. Have a great day.